The FDA is backing a potential game changer for people who don't get enough sleep. Some 60 million Americans have a form of insomnia. It affects 40% of women and 30% of men. The government announced the approval yesterday of a groundbreaking type of sleeping pill. Dr. Carol Ash is the director of sleep at Meridian Health. Welcome.
Thank you,
So
Charlie.
what's different about this one?
Well, this is an exciting new drug. It really is a new tool in the toolkit for the treatment of insomnia. Typically, sleeping drugs are a knockout punch to the brain. They actually knock out circuits throughout the brain. Kind of think of like a house where you get a surge and the electricity goes off with the refrigerator, the TV, not just the lights. So this drug actually is like a switch that turns off just the lights. It works by inhibiting orexin, which is a neurochemical that actually wakes up the brain. It stimulates the areas for wakefulness. So it's very focused.
But it still has some of the side effects, right, that pills have.
Yes, unfortunately, and that's why the FDA actually delayed the approval of this drug, because when they initially tried to launch it, they used higher dosages that actually caused things like drowsy driving and even suicide. So it was really initially a concern.
When will it be available?
Well, it's approved by the FDA, and now it's going through approval by the DEA. And one thing, Charlie, though, even though, yes, any sleeping pills have side effects, the consequences of insomnia are serious. They can result in depression, diabetes, hypertension, drug abuse, and even death. So you don't just want to use medications. There's other things that you can bring into the mix, like behavioral therapy, that can really help.
Other than the question of side effects, there's also the question of dependency.
Yes. Well, you know, the statement from Merck is that in their studies, they didn't actually see any dependency or any problems with withdrawal. But whenever they do these studies, it's a small number of patients. We have yet to see what's going to happen when you expand it to large populations.
All right, Dr. Ash, good to see you. Thank you so much.
It's a pleasure.
And it is just about 7:19.